Hello, welcome to Combat Magazine. We have a very special guest with us today of REMART Medical. Before we continue, we would like to have Mr. RENAUD Jean-Louis introduce himself to the community, to the people that are watching. Please, RENAUD, how are you? And please introduce yourself.
Hey, Pat, thank you very much for giving me the opportunity to talk to our community. First of all, let me say my name is RENAUD Jean-Louis, as you just said earlier. I'm a family nurse practitioner as well as a psych mental nurse practitioner. Basically, what it is, we do see patients that medical and mental health. I'm currently working at Jackson Memorial Hospital, one of the biggest hospitals in South Florida, where I work in palliative care and transitional care unit. We decided to open a new clinic last year so we can serve our community, most likely people that have mental health issues. We have that myth in our community, which people always think that, you know what, mental health is a bad thing. It's not. Mental health, it's real, it's serious, and there's treatment for it if you take it very seriously. And at the same token, we incorporate the medical practice in there as well, where we most likely see patients regardless you have insurance or you don't have insurance. That's the reason why that, you know what, I want to go at length and explain that community. That clinic located in Hollywood is here to serve that community and help them if they have an issue, either mental health or medical.
Okay, before we go further into that, let me ask you, how did you come up with the name REMART? Where does the name REMART Medical come from?
Basically, that name, you know, me and my partner, we went to school together. We went to Nova. We always think about like coming with something. So we come with my name, RENAUD, and Martin, which is my partner, and we call it REMART Medical. It's a combination of our two names.
Okay, REMART Medical. Okay, Winnie and Martin. Okay, it says that you take a primary care as well as mental health. People, describe for the people that might not know fully what exactly do you offer in the primary care field and as well as the mental health field, because I'm sure there's different angles to it.
Yeah, first of all, I'm working in a hospital setting where usually that people that come to the hospital, by the time they realize that they have a critical issue, it's already too late. Let's say, for instance, that somebody that have hypertension, or they have diabetes, or high cholesterol. So by the time they come to the hospital, it's already too late because, you know, they don't know. That's why usually, like we call high blood pressure, the silent killer, because you may have high blood pressure for years, but you never know about it. For instance, you wake up, you may say, oh, I have a bad headache this morning, maybe I'm tired, or something happened. It's not that. It's because you have hypertension that's not controlled. And by the time that you realize that there's something critical, you come to the hospital, you realize that, you know, you have a stroke, a massive stroke. Sometimes you may be able to make it, sometimes you may not. So that's the reason why that, you know what, we're here to educate that community. We're here to help them. If you have a medical issue, you have hypertension, you have high cholesterol, diabetes, we're here to help you, to assist you. Our clinic is most likely focused on prevention. Preventive medicine is the key. We in healthcare spend so much time in treating acute chronic disease instead of spending time on prevention. And I do believe by preventing those things, somebody that have hypertension, high cholesterol, diabetic, by preventing those things, go further. Not only like, you know, that help that patient to have the quality of life they deserve, it will also help the family. For instance, Pat, you the head of the household, you're taking care of your own family. And then you know what? You become sick. You can't take care of that family. Guess what? The entire family get affected because you've been working 24/7 and you don't have time for yourself to even go see a primary care. So that's one of the things that we do here in the Remark Medical Clinic. We open all the way to 7, 8 o'clock. Somebody that go to work in the morning, you have time to come in the afternoon. We will come see you, all the way to 8 o'clock. Somebody that work on weekdays, we can help you, see you on Saturday and Sunday open appointment. So we're trying to cover all aspects so we can help that community, that people that need to see a primary care doctor to be there for you. That way you don't have to wait at the last minute. If you have hypertension, we can target it, put you on medication, put you on a regimen, put you on that can take care of this thing before that you have a stroke or you have any other cardiovascular disease. That's for the primary care. So now let's talk about mental health. Mental health, that's what we call in our country that's not munfu. So people think like, sometimes they're hiding it, but they think there's treatment for it. Somebody that have schizophrenia, somebody that have bipolar disorder, somebody that have addiction, alcohol addiction, somebody that have depression. Depression is real. So you see what happened most of the time, let's say there's a shooting, first thing that they do, he may have a mental health issue. Let's just go ahead and see if we evaluate that patient. So if we take it very seriously, you have somebody that you can talk to, you have somebody that, you let them know what you're going through. You're going through a divorce that can target depression, that can target stress. So there's a lot of people that have a mental health issue, specifically in our community. They don't want to look for help. We're here to help those people. We're here to assist those people. So you come to our clinic, both aspects will be met. You have primary on one hand, and you have mental health in one hand that can help you in one step.
Okay, well, no, how do you get or how do you convince somebody to come to your practice? Because if they're afraid or ashamed to say that, to admit that they have a health issue, if they're a lot of people, they don't want to say that they have a mental health issue because they could be ashamed. How do you convince people like that to get up from their house and come see REMART Medical?
So one thing that we try to do, we try to meet those people. We try to call them, talk to them, educate them, and meet them halfway, educate them. For instance, somebody you have somebody at home that have a mental health issue that is ashamed of it. You call us in that clinic, and then we will go ahead and try to talk to those people, because most of the time it's education, therapeutic conversation with those people. Try to bring them to see us. We will talk to them, try to educate them about mental health issues. When they come to us, we will tell them, we will have a plan of care to let them know what will be the best thing for them. Let's say, for instance, they have bipolar disorder. Bipolar disorder, sometimes people may be depressed, sometimes they may be manic, they become very psychotic, they acting weird. So we will put them on medication. So we're trying our best to put the word out there to let people know there's no shame to it. As a matter, it would be worse if you have it or your loved one has a illness and then you don't look for help. That's the reason why we open late, we open early. So if you want to come early in the morning, we'll be more than happy to do that. If you want to do telehealth, you want to stay home so we can talk to you, we will do that as well if you don't feel like coming to the clinic. But we're trying all the mechanisms to see what we can make an impact to that community, educate them, and let them know it's real. So we're here to assist and assess those people that have, a very serious issue that's killing our community.
Okay, in terms of the elderly who might not be able by themselves to drive or to come to the clinic, do you offer any services or anything that you can get people to go get them to come bring them to the clinic and back and forth? Do you offer those services?
One thing that I can tell you, Pat, we have also a concierge services, which means that you have your mom, your dad, you go to work, they have somebody at home with them that can come to the clinic. We will come to the house. We will send one of our practitioners to go home, to see them, to evaluate them, to assess them, and to treat them. And the most important thing, instead of taking them to a place to do the lab, we will send somebody to draw the lab at home, and then they will email us or fax the lab result with us, then we can call the family or the kids, review the lab with them virtually, so we can go ahead and establish a plan of care so we can move forward with those people.
Okay. Well, how did this business start? How long has it been in business, and how did you start the business?
So technically, we just started about like a year and a half ago. And I came with that thing, as I said earlier, is the fact that, you know what, so many people come to the hospital, and most of them patients, they have an issue which they don't know. By the time they realize that, you know, they have it, it's already too late. So I said, I need to do something for those people. And one of the things that I think that I can make a difference is to open that preventive medicine care clinic, which I can educate those people. I can target any issue that they have before. That's the reason why that, you know what, this year, we're gonna open, like, you know what, a membership for people that uninsured, that don't have money. We're gonna open a membership for them, which means, like, you know what, they would pay an annual fee, and then every year we will go ahead and renew that. And that they will come, we see them, we have appointment with them, we follow up with them. If they have any issue, then we will go ahead and address that. And also for our wonderful musician, Pat, I don't know what to tell you again. And I was talking with Tonton Bichal last week, and which he asked me to come up with something very special for the musician. So we're doing something specifically for the musician, very low cost for all musician, patient physician that's out there. Because believe it or not, those people, they're working hard. They work at night, they don't eat well, they drink, they don't have enough sleep, and the worst, they don't have a provider. They don't have a personal provider that can help them. So what we're trying to do, we're trying to work with a bunch of like musicians, with some of the managers, to see what can we do for those musicians that don't have a PCP, that don't have a primary care. Before that you go any further, what can we do to help them? What this thing gonna consist of specifically? Let's talk about the musician. It's a membership that's gonna be designed for them specifically. All they have to do, they're gonna need to call our clinic. They can either like email us at remartmedical@gmail.com, that's our clinic, or they can call us to this number that we have here, 954-639-4866. They call the clinic. They have to be like a musician playing in a band, or it may be like the manager. The manager is part of the band too, because, you know, they work with them. They will give us the name, date of birth, which band they're playing, and then we will have a plan of care for them. Basically what it does, they will come, we will do an assessment on them, we will do lab on them, and then we will do the follow-up. The most important thing, we're gonna have special date and time so they can come to our clinic. Usually we're gonna do it in the afternoon, but when we're not that busy in the morning, they want after 5 o'clock, we will have all those people, I'm talking about the musician, come to our clinic. And then, you know, the lab, we will send people to do the lab at the house, wherever they are. Let's say like they're gonna have like a rehearsal. They will come there and do the lab for them. And then, you know,
at rehearsal, you would go to the rehearsal place and do the lab for them. Is that what you're saying?
We will go at, if this is what makes them feel comfortable. Because, you know what, I want to make sure that I help those people, because it really hurt me. When you see those people, I mean, I was listening to Gazman that was playing Saint Cecile, which is one of my favorite songs, which is, you know, they don't really have time for the family. They spend all the time playing, but you know what? I don't think we never give them something back. We at REMART Medical Clinic want to do something very special to them. So they can reach out to us at remartmedical@gmail.com or call us at 954-639-4866. We will have a special price for all Haitian musicians. Specifically, we call it VIP membership, which we will go ahead and help those people and make it different to those people.
I was going to ask you the next question. How much money is the VIP plan? How much money do they need to have to bring to you just to get that thing started?
I mean, you know, you don't want to believe that it's a very small fee. It's not something that we get. We will charge each one of them like, you know, $250 for the membership. I think, you know, it's
$250.
something like, you know, that's what they get paid each gig that they play on weekend. So we cannot go any further because, you know what, they're working hard. They're trying like to please us. We go and dance. But in return, this is one thing that I want to give them back. I want to help them.
Okay, no, the $250, that's a one-time fee for the whole year membership, or is it a visit every time they visit?
It's a one-time fee, which they will have an assessment. We do the lab, and then we do the follow-up. And the event that they have, like, you know, let's say that they have the diabetic, we will need to monitor them, like, you know what, every 3 months, because we have to check their hemoglobin A1C to make sure that blood sugar is under control. We will go ahead and give them at least like 3 more follow-up. Basically, like, you know, it's one assessment and 2 or 3 or 4, 3 follow-up based on the illness that they may have.
Do you offer any plans to bands, like, let's say if a band wants to have insurance, medical insurance for their musicians, do you offer any such thing?
Yes, we do have like, you know, the same plan for them, but it's a little bit more expensive for people that don't have insurance. We will probably like charge them about like $500 for the year, which is like, you know, also a membership for all the uninsured people that can't go to a doctor's. And the most important thing, we will even find a way to give them discounted medication. Because, you know what, sometimes somebody that have diabetic or have hypertension, they will need to be on medication. If they need that, we'll find a way to put them on those medications to a discounted price.
Okay, if you have a message to all the musicians that you want them to take this thing seriously, because a lot of musicians, like, they don't want to, not just musicians, people in general, but since we're talking about musicians, they don't want to go to the hospital. They don't want to go see a primary care doctor. You know, when you say doctor, it's like they're afraid. They don't want the bad news because they are afraid they're going to get some bad news. What motivational message can you give them to come?
First of all, I think that, you know, if Tonton Bisha see the problem in that same group, it's real, it's serious. When Bishop called to me and said, you know, we need to do something together. This is one thing that, you know what, you can give back to those musicians. And I don't want to see that, you know, one of them come to my hospital, I mean, to Jackson, wherever that I'm working, and I can't do anything for them. There's help out there. Before that you get sicker, before that thing becomes very acute, before you have any stroke, before you have any cardiovascular illness, we can prevent that. That's the reason why we decide to help you. Our door is wide open to those musicians. That's the reason why we do it at very, very low cost, which you don't really get anything from it. We just want to help those musicians because it hurt me when I see like, you know what, those musicians have to stop playing because they have a chronic illness. They don't really take it very seriously. If you have a stroke, there's possibility that, you know what, you may end up like not able to play again because you're gonna need a lot of therapy. If you don't have insurance, you don't have therapy, what's gonna happen? So let's try to see if we can prevent those things. We're here to help them. They should take it very seriously. And then, you know what, in the next 5 to 10 years, they will come to REMART Medical and say, you know what, we know you make a difference for us, and we're very happy that you come with that plan. And they will and they must take it very seriously.
Okay, well, no, just for this part, just briefly, just for the musicians that might not fully understand English, I'm not sure if you want to do that in Creole, just briefly, pour dire comme ça why it's important, pour qu'il soit important pour yo venir.
Bon, j'aime ça dit tout à l'heure là, c'est extrêmement important parce que là que ou bon maladie qui là ou pas même connaître même. C'est ça que fait le hypertension, the silent killer, qui veut dire li là sous ou pas même connaître sous faire attention. Ou lever ou surtout mon petite tête fait mal ou c'est fatigue, même jouer la nuit, pas dormir, c'est fatigue. mais il y a son blood pressure qui on contrôle, qu'on pas contrôler. Les que blood pressure ça pas contrôler, ça va le passer. Atterrir au courant qui pour faire blood la circuler après maintenant, venir comme tout tif et puis ou fait un choc. C'est ça fait nous dire que tout a pas choc, hémorragique choc, ischemic choc. L'on fait yon là-dedans yo, il met des cris de corps. That one, ou fait tension, ou pas contrôler, ou ka perdre kidney, ou ka perdre rein. Ça passe ce qu'on est. Ou pas besoin pour aller dans dialysis 3 fois par jour. Pour yo clean sang, ou pas besoin ça. Ou fait sucre, ou ka end up perdre pied ou parce que vous faites dans sucre là pas contrôlé. Ou fait cholestérol, ou commence à développer plaque dans artère qui vient de bloquer artère complètement, capable de faire ça ou les anévrisme, l'autre pété dans toute tête ou dans tout côté. So, il est extrêmement important si que vous faites tension, vous faites sucre, high cholestérol, nous mettons un médicament pour vous, ça ka aider ou même avec famille pour continuer à jouer, pour continuer à battre public ça qui remonte pour ba au plaisir que besoin parce qu'on a médicament. Mais si vous pas prendre médicament ça ou pas comme ça, il a plus mal pour demain si Dieu veut.
No, one last word to that you want to mention that maybe you didn't say anything that you forgot to say. Go ahead.
But one thing that I have to tell you, Pat, thank you very much. I think, you know what, it's a very big, important issue that, you know what, 21st century, this doesn't really make any sense. People are dying because they don't have insurance. We want to make a difference. We want to make a difference, and we will make a difference. That's the reason why we come with that plan, not only for the musician, but also for anybody that don't have insurance. I want to come see us. Again, we're located in Hollywood, Florida, 2750 North University Drive. We can contact us at 954-639-4866, or you can email us at remartmedical@gmail.com. And for further info, you can go to our website, remartmedical.com. You can put your appointment online, and we will be more than happy to assist you. Even though you don't know that you have any issue, just come. We will be there to help and assist because we want to make a difference and help those people, specifically those that have a mental health issue.
How often do you suggest that somebody get a physical, I guess, or?
A physical exam is something that everybody should do every single year. Every year, you need to have a physical. That way, if there's something going on, we can catch it early. And like I say, most of our musicians, most of them are in the late 40s, 50s. They may need to have, like, you know, a colonoscopy. They may need to check the prostate. They may need to check those things to see if you may have prostate cancer, because this is very common. Prostate cancer and colon cancer, those are real. So if we catch those things early, believe me, there's treatment for it. We can resolve it. But in order for us to help you, we need to at least do an annual physical so we know what's going on with you, so we can take care of it early.
Okay, speaking of those two, for people that might not know, just tell them briefly the difference between colon cancer and prostate cancer.
Okay. Prostate cancer, c'est ça qui fait pour le monde qui a 40 ans, 40 and 50. You need to check your prostate. We need to check to see what's going on. So we usually do a PSA to check the level. Based on that level, it will let us know if you are high risk to have a prostate cancer. Sometimes what's going to happen to you, you may end up losing your manhood because you have something that you don't know. But if you take it early, you can save that your manhood. The same for colon cancer. Once you get to 40, specifically African American Black, 40, that's the age that, you know what, they usually recommend that you have a colonoscopy where they're gonna check your colon to see, you know what, if you have any risk, if you have any suspicious thing that you may be at risk for colon cancer. If they see it early, they can catch it and clean it. So we want to make sure that, you know, people take those two things very seriously. Those are the two most common cancers that we have: prostate and colon cancer.
So what are the symptoms basically? What are the
symptoms? Pour prostate là, capable être pour pipi sang, ou capable sentir que dans ceinture d'eau à formal. Those are the signs. But sometimes you may not have any sign. But you do the PSA, you will realize the PSA is high, probably like in the 5, 10, 15. You may not have any symptom. Compared to colon cancer, you're gonna start having like abdominal pain, you have constipation, you don't go to the bathroom on a regular basis. There's a lot of other symptoms that you may have, but those that I just said are the most common ones. So when you see that, I don't used to be constipated, or when I poop, I see like there's blood on the poop. Those may be signs that, hey, you may have something suspicious. You may want to check your PCP to help you.
OK. Et Renaud Jean-Louis, Renard Médical, Remart Medical, et ou dernier mot pour fanatique. Go ahead.
Once again, nous là pour you, for the fans, for the public. Remart Medical is here to assist you guys. Please do not hesitate to come see us. We're located right here in Hollywood Boulevard, in Hollywood, Florida, excuse me. Even though you're away, New York, Boston, we can see somebody that have mental health issues through Zoom. That's what we call telehealth. We will be more than happy to assist you. For those musicians that in Haiti, they can always call us, email us to see what we can do for you. If you come to play, we can always find way. If you need medication, to just go ahead and send those medications back for you and Haiti.
Thank you, Renaud. C'était avec nous, Renaud Jean-Louis. It was Renaud Jean-Louis from Remart Medical. Thank you very much. And again, you have all the information, and we'll be sure to pass it along to them. Once again, be there, get ready to take advantage of this program that he is proposing. Musicians.
Specifically those musicians.
Yes, musicians, be aware. Merci, Renaud. Thank you very much. We'll be in touch.
Thank you very much. It was a pleasure.
Thank you.